South Jersey Glory Days fans, welcome into our Shore Ortho Series. We're here to introduce you to some of the doctors, some of the great doctors that Shore Ortho has throughout its locations in Atlantic, Cape May, Ocean counties, throughout the Shore area. We're here today with Dr. Ted Lai. And Doctor, introduce yourself a little bit to our fan base. Tell them a little bit about yourself and your specialty here at Shore Ortho.
Thank you so much for having me. My name is Dr. Ted Lai. Born and raised right down here in Galloway. Was fortunate enough to come back to my hometown area and practice this beautiful area serving Cape, Atlantic, and Ocean County. What I do, I specialize in foot and ankle surgery. I'm fellowship trained foot and ankle surgeon, trained up in Philadelphia and then fellowship in Pittsburgh. And like I said, I was lucky enough to join this amazing group here, which we're a real big part of the community. And really provide back and be part of the pillars of the community.
What was your impression of Pittsburgh? A little bit different out there in Western PA.
That's a whole new area. Pittsburgh's very different. It's a beautiful area, great people, a little slower pace, but I'd definitely say a beautiful area and a great place to visit or live.
A little different culinary experience out there too. I hear they put the French fries right on the burgers. Is that right?
Yeah, that's their big thing in Permanentes. They have burgers on their French fries on the burgers.
Right.
Big sandwich, messy, but it's good. They're also a big sports town too. You go down that town,
for sure,
everyone's wearing some type of jersey. Rather than on Friday night, we'd be wearing our polo or dress shirt. They're wearing their Ben Roethlisberger jersey or their Pirates jersey. I'm like, oh, okay, that's what you're wearing tonight.
Now, tell us a little bit about your high school experience. What made you become a doctor? Did you know back then that this is something you were interested in?
So, high school experience, I went to Absegami. Didn't play really too much sports for the school because my big sport was hockey at the time.
Okay.
So I played roller hockey, ice hockey for the surrounding area, in the leagues there, you know. At that time, I knew I wanted to get into some type of profession helping people, and I knew medicine was that. Growing up, I had, my brother had an ankle fracture. I had some ankle sprains and issues. And that kind of just set the seed right there and then started me on that path of being a foot and ankle surgeon.
Did you know what you were getting yourself into with, 10 years of school and all that to become the kind of doctor you're at now?
No, not necessarily. And I was like, just stay on the track, keep going, and take everything step by step. And as each step and hurdle came across, I just loved it more and more. And you're like, this is what I want to do, and this is how I'm going to help people. And that's what I kind of loved about it.
How did you focus on foot and ankle? Was that something that just came naturally for you? I'm sure every doctor has a little bit of a different interest. So when did you realize that this is something I want to do and this is something I want to concentrate on?
Well, medicine is such a big field. You can treat many different various areas. But I felt that with foot and ankle, there's a lot of my early history of injuries, number one, but then also you can use your hands to really help people, fix people. And you can kind of see, when I had followed up with other foot and ankle surgeons, you can see that you can actually provide relief right there that day or in that and really change their life and bring them back to function. And it was that type of feeling, that self-satisfaction of I helped this person, was the game changer for me.
How much of a psychologist do you kind of have to be? Because that's a difficult injury when somebody breaks an ankle, has something really difficult with the foot or ankle. That can be a long rehab process where it gets sometimes it gets depressing because they're not seeing progress, things like that. How do you as a doctor kind of try to keep them on track and try to keep them hopeful about the recovery?
You're definitely right about that. It's not just the physical component of healing, but also the mental and emotional component of healing too. If I injured my finger, okay, well, I'll use my right hand then.
Right.
You can get by. On the foot, on the other hand, if you fracture your ankle, rupture your Achilles tendon, there's a time period that you need to be non-weight bearing in a cast, using crutches, walker, and knee scooter. That's tough for people to feel vulnerable, to feel that they can't be back to activity, to be on pause in your life. But what I do is I have a long discussion with my patients about what's going on, what are options for treatments, how we get them better, and how we make this as smooth as possible for them so it doesn't feel like they're burdened about it and that it's impossible. And really taking that time to make them understand, it makes the whole process go smoother, and then we're all on the same page,
right,
and we get a better successful outcome.
How do you break it to somebody when you see something that's probably worse than you thought originally or they thought, when you see a very complicated kind of surgery up ahead for somebody? How do you kind of make them feel at ease? Like, hey, I know what I'm doing here. We're going to get you
Yeah.
right.
Once again, education. Education, you got to educate them on what's going on. It's not the old days where the doctor says, this is what you have, this is what you're going to do. No, the more they know, especially with modern technology, they can research that. So the more they know, and also just kind of explaining to them, setting the right expectations is important. This is where we're at, this is what we're going to do. It's difficult, it's complex. These are things we can see in the future that might come about. And if it comes, we'll prepare ourselves for that. It's all about preparation. It's
Right.
not just where we're at today, but it's where we're at next year, in the coming years, and we're going to attack it at that point if it comes to that.
Now, when you're treating a high school athlete, they want to get back to the game as quickly as possible. But sometimes with a broken ankle, you might be looking at 9 months, a year kind of recovery. How difficult is it for them to understand what's ahead, and how you're going to try to make them the athlete they were before that?
So the first thing when we're treating athletes and all patients is that primary goal is get them better. And that's without a question. That's shouldn't be as stated. But what I try to do is not just getting better, but how fast can I get you better? How fast can I get you back to playing? Now, with medicine constantly evolving and the innovations and techniques we have,
Right.
I'm always looking for new things and new techniques to do to help my patients get to that level, whether it's different type of implants or plating or screws or early rehab with aggressive physical therapy. Those things make a difference, such as Achilles tendon ruptures. That used to be 6 weeks in a cast, followed by boot, long physical therapy, long recovery. You'd be out for a year, which the pros are. Where there's new things, minimally invasive surgery, repair of that, aggressive rehab, which we're getting people back to activity in 3 months, 4 months, which is unheard of.
Yeah. Sure.
And it's all working together, doing the newer things that's helping people get there. But also, saying, okay, let's look at the big picture. This is what we want to do, where we need time to heal, and that's the most important thing.
Now, how do you handle being a doctor and all that comes with that, while also having 4 children?
I try to, just keep myself organized. And at this point, try to keep things separate, I do my work when I'm at work, but also keeping things in mind that need to be accomplished. But then when I'm home, I'm with my boys.
Yeah.
I give them their time, we play, we handle all of the responsibilities. But I really try to separate them as best as possible.
Before we wrap it up here with Dr. Lai, Doctor, what's the best thing about working at Shore Ortho? Why are you here, and what is the most fulfilling part of your job?
Like I said at the beginning, I'm fortunate to be here. This is an amazing group filled with amazing talent in this area. Coming down here, you're thinking that coming from big cities, that this area does not have the skill or the surgeons needed. That's completely false. We have some of the best surgeons in this group. Not only the best skill that we have, but we really have the same motto. You treat the patient from the beginning to the end. We're seeing them from the beginning, whether it's conservative or surgical. We're seeing you at the end. And it's that community feel. We're part of the community. You're going to see me out there. We like to make relationships. And then really, importantly, getting you back to what you love to do. That's the main goal.
Dr. Ted Lai from Shore Ortho. We'll have more on him at sjgloriadays.com coming up. So check out our website. Check us out on Facebook, Instagram, Twitter. And we'll be back with more doctor interviews from Shore Ortho. So stay tuned with us. And Dr. Lai, appreciate taking some time.
Thank you so much. Thank you.
Thank you. And if you're in the need for a foot and ankle surgeon, he's the man.